The Alliance of Health Workers is dismayed over former Police Chief Camilo Cascolan's appointment as Health Undersecretary. The group says it's a clear manifestation of the President's extreme lack of concern for the lives, health, safety, and welfare of health workers, adding it's a huge insult to health experts most qualified to run the affairs of the health department. They're also concerned over his background as one of the brains behind Oplan Double Barrel in the Duterte administration's controversial anti-drug campaign. They say they'd rather have an undersecretary with a clean track record and an expert in eradicating deadly and infectious diseases. The Philippine Medical Students Association also condemns his appointment. They say the health department is mandated to provide public health services to the people, and Cascolan stands as a contradiction to preserving life. Aside from his connections to the drug war, they say Cascolan is not an expert in medicine or public health. The group wants the president to appoint health officials with medical backgrounds. Cascolan graduated from the Philippine Military Academy in 1986 and briefly served the military before joining the PNP in 1992. He also took Master of Arts in Public Administration in UP Visayas. In 2016, Cascolan was assigned as PNP Directorate for Operations, where he co-authored Oplan Double Barrel. He was the 24th PNP chief and only served for 2 months after reaching the mandatory retirement age in November 2020. In February 2021, he was appointed Undersecretary at the Office of the President. In a message to CNN Philippines, Cascolan said, "One doesn't need to be a doctor to serve in the health department," adding that balancing science and strategy is very important. Cascolan said his expertise on emergency response and his network and experience play a big role in bringing health closer to people, and he could also be of help in anti-COVID protocols. Cascolan said he helped create the PNP Medical Reserve Force, which was in charge of several testing sites.
Surprising kasi to a certain degree, kasi first time sa Department of Health.
Public health advocate Dr. Tony Liachon says Cascolan needs to be assigned to the right position like regulation and procurement and not in departments that would require experience and expertise in the medical field.
You should hit the ground running right away. Now, if you're going to learn the ropes at the time you are in crisis, then that may be a problem. Regulation and procurement. With your background, let's say, on being a disciplinarian and of course the attributes of rigor, baka makatulong yun, no?
Cascolan isn't the first military man to serve in the health sector. During the pandemic, several military men headed the response, like former Secretary Carlito Galvez, who led the procurement of vaccines. Liachon says there were delays, complaints over the choice of priority vaccines, and expired supplies, which could have been prevented if the medical perspective was given more consideration. Caroline Bongkin, CNN Philippines.